Hello doctors, welcome back to my channel again. Today we are going to start the new subject that was a preventive and social medicine. In that first chapter we are going to discuss today is levels of prevention. That is a very small topic, but still you can expect one question at least in any exam, in any medical exams you can expect one question at least. And these are my QR codes. You can scan here and you can access the PDFs anytime you want. And without any further delay, we are going to start the levels of prevention. In the levels of prevention there are four levels of prevention. These are a primordial level of prevention, primary level of prevention, secondary level of prevention, tertiary level of prevention. So let's, you guys repeat with me: primordial level of prevention, primary, secondary, tertiary. Primordial, primary, secondary, tertiary. So what, first I'm going to explain the four levels of prevention, and next we are going to write the notes. Okay, so what is this primordial level of prevention? In the primordial level of prevention we don't have any risk factor. So what does the risk factor means? So the factor that is going to cause the disease, so these are the risk factors. These risk factors are absent in primordial level of prevention. So in the primordial level of prevention nothing was there, so no risk factor, no disease, nothing was there. But when it comes to the primary level of prevention, here what we are going to do is, here disease is not present, so the patient is not having any disease, but he is having the risk factor. Let's say if my family, my grandfather is having cancer. See, the cancer is a risk factor, but I don't have any disease. Still, I have a risk to get the cancer. This comes under the primary. Okay, this is how we are going to differentiate between the primordial and primary. In primary, risk factor is there, but no disease. In primordial, there was no risk factor, no disease. Nothing was there in the primordial. But in primary, what we have? We have risk factor, only risk factor, no disease. Okay, so when we comes to the secondary, so secondary means whatever the test we are going to do. Let's say if you go to, like, a pregnant lady goes to the hospital for a screening test, right? The screening means she is undergoing the ultrasound, like once in 3 months or 4 months she is undergoing the ultrasound. So ultrasound for the screening, like ultrasound for pregnancies, like any other test you undergo, like pap smear for the cervical cancers we are going to do. So these are also comes under the secondary levels of prevention. See here, all the screening test, whatever the test they use in the examination question, and the disease is also present here. So let's say in the questionnaire asks you, the lady presents to the clinic, so she undergone the pap smear. See, this is a screening test, right? So here the chances of disease can be present. Disease is present, may be present or absent, but there was a, most of the factors are present. Why the patient comes to clinic? If she is having some, if she is having like some symptoms or some kind of disease symptoms, so that's why she comes to clinic. So we are going to screen the patient. So all this screening test comes under the secondary level of prevention. Okay, what does this tertiary level of prevention? See here, the patient is having disease already. Let's say if patient is having cancer, what we are going to do? We are going to prevent further infections. Like if the patient is a chronic smoker, let's say, what we are going to do? We'll send him to rehabilitation center to prevent further complications. So in the tertiary level of prevention, what we are going to do is, we are managing the complications and we are preventing the disability. Means the patient is undergoing worse, but we are going to prevent that. We are going to prevent the disease complications. This comes under the tertiary levels of prevention. Okay, so let's write the definitions of each of them, so you're going to understand it better. Okay, so in the primordial levels of prevention, prevention of occurrence of risk factor. See here, no risk factor is there, no disease is there, so I'm going to specify it. no risk factor. Minus means no risk factor. No risk is there. See, and no disease. DS means no disease. Here no disease. And next we are going to write for the primary. Primary, what I said you already, in the primary there was a risk factor. Risk factor is there but no disease. What we are going to do here is prevention of disease in presence of risk factor. Let's say risk factor is already present in the primary. We are going to prevent the disease from the risk factor. This is the definition of primary. In presence of risk factor. Let's write it here. See, here risk is present but disease is absent in the primary. And when it comes to the secondary, in secondary what we are going to do is we are going for screening test, right? Screening test is by, if you do the screening test, we are going to diagnose the disease early and we are going to treat the disease. So we are preventing the further complications of the disease. So screening always comes under the secondary. Remember this. Any screening test, if they ask you any screening test in the question, you need to mark the answer as secondary level of prevention. See, early detection and treatment. Here screening test, all the screening test comes under secondary level of prevention. And the tertiary, here the disease is already present. And I forgot to tell you, in the secondary disease is present. Okay, in tertiary, here we are managing the complications. Okay, the disease is already present, so we are going to manage the further complications of that particular disease. Here in the tertiary, the management of complications and prevention of disability. Here everything is present. See, here let's say this is the final stage of the disease. Tertiary level means the final stage of the disease. The patient is severely ill, so we are going to prevent the further complications of the disease. That's why it comes under the tertiary level of prevention. So what are these phases mean? Phases, there are 3 phases are there: pre-pathogenic phase, early pathogenic phase and late pathogenic phase. See, here primordial level of prevention means pre-pathogenic phase. See, here no risk factor is there. Pathogen means something causing the disease. See, here nothing was there. No risk factor is there. So what is there? No pathogen, right? So this is pre-pathogenic phase. Let's say with me, pre-pathogenic phase. This is pre-pathogenic phase. So no risk factor is there, okay? And no disease is there. And in primary also, disease is absent, just the risk factor is present. See, whenever the disease is present, that was pathogenic phase. If there was no disease, that was pre-pathogenic phase. See, in primary also, disease is not there, only risk factor is present. In primordial also, disease is not there and risk factor is also not there. So these two comes under pre-pathogenic phase. So these are not tough, these are very easy. So you just need to know, and if you read it again, you are going to catch the points, okay? And in secondary, see, I marked it again, marked it here, disease is present. So it comes under pathogenic phase. Let me write it, pathogenic phase. Here, what pathogenic phase? This is early pathogenic phase. Here the disease is present but we don't know exactly like disease is present or not. Let's say if we are going for the screening test, if the disease is present, maybe if the disease is present, or else the disease can be absent. So that's why I write it as early pathogenic phase. Let's say if the disease is present, it comes under the early stage. We are detecting the disease in early stage, so we can treat it well and the patient going to be better. That's why it comes under early pathogenic phase. And tertiary means late pathogenic phase. Here the disease is progressed already, so we are going to prevent the further complications. That's why it comes under the late pathogenic phase. And in the next slide heading, see, I'm going to explain it again in very shortly. In primordial phase, what we are going to tell you is primordial phase is prevention of occurrence of risk factor. See here, no risk factor is there, no disease is there. In primary, there was risk factor. Some risk is there, but no disease. In secondary, we are going for screening test. If you see any hint in the question, like a patient is undergoing the ultrasound or any other test dimensions, you need to mark it as screening test. And in tertiary, there was disease already, and to prevent the further complications, we are going to manage the complications. That comes under the tertiary levels of prevention. And how we are going to achieve this primary, primordial, secondary and tertiary levels of prevention? First, in primordial levels of prevention, what are the examples? I am just going to give the small examples. Like the government is offering many health awareness programs, right? Whatever the awareness programs is there, these all awareness programs comes under the primary levels of prevention. Okay. In primordial levels of prevention, we are going to health educate the people. Okay. Here, the health education comes under primordial levels of prevention. Let's say we go to the school. Let's say as you are a doctor, you go to the school. They are 9 years or 10 years old age kids. You're going to tell them, don't start smoking. See, there was no any risk factor is not there, right? In primordial, no risk factor is present. See, they are not having any risk factor for cancer. They are not having any risk factor for lung cancer. Still, you are advising them, you are giving the good suggestion, you are giving the awareness for them, so not to start the smoking. That was a health education. So, do not start smoking. I'm going to write it here. Do not start smoking. And changing stag water to prevent mosquito bites. See, these two comes under the primordial levels of prevention. When it comes to the primary levels of prevention, here what we have is risk factor is already present. Let's say the government asks everyone during the COVID time to wear the mask. I don't have any disease, I don't have COVID, but government asked me to wear the mask. Means there was a risk factor of COVID already in the environment. So to prevent that risk factor, I am wearing the mask. So this kind of examples comes under the primary levels of prevention. See, in the primary levels of prevention, there was risk factor present and disease is absent. To prevent the disease, we are going to wear the mask. To prevent the COVID, I am going to wear the mask. So these all kinds of examples comes under primary levels of prevention. Under the primary level of prevention, I am going to write it avoiding disease. Again, I am going to writing the definition, avoiding disease in presence of risk factors. Risk factors are present, but to prevent the risk factors, by preventing the risk factors, we are avoiding the disease. It is primary levels of prevention. Okay, in the primary levels of prevention, there will be an health promotion and specific protection. What does this health promotion means? If the government asks to do some things to prevent the disease, these all are health promotions. if you are wearing, like let's say if you wear a helmet while driving, if you wear helmet while driving, if you wear a seat belt, so these all are coming under specific protection. Means you are protecting yourself by preventing the damage, more damage. If you met with an accident, you are going to prevent yourself, you are going to protect yourself. Only this is for yourself, this is only for individual protection. So this comes under the specific protection. These all examples comes under specific protection. Let's say in specific protection, if you use helmet, use seat belt, if you vaccinate, by vaccinating you are going to benefit, right? You are going to prevent the disease. You are already having the risk factor, but you anyways you are going to prevent the disease. So if you give the pregnant lady iron folic acid tablets, right, you are going to give the pregnant lady iron folic acid tablets. So all these examples comes under specific protection. That was like I am benefiting for my own health. Okay, I am benefiting my own health. So this comes under specific protection. When comes under the health promotion, so whatever, like safe water supply, if you give the safe water supply, like everyone is going to benefit, all the community is going to benefit, right? Good sanitation facility, if there was a good sanitation facility, you are going to prevent the diseases. You are already having risk factor, but you are going to prevent the disease. Okay, controlling air pollution, if you control the air pollution, let's say if I am going to control the air pollution is controlled, then your health will be better, right? Not only your health, your surrounding people's health will be better. So it is benefiting the community. And midday meal program, let's say if you give the good midday meals for the children who is studying under the government schools, so they will be healthy, and they will be in they will prevent the malnutrition. Okay, so this is also benefiting the whole community of children. And health education is also benefiting whole community. If you put the any ads in the televisions, let's say if you put any ad in the TV, let's say now the most of the people are suffering with the cervical cancers, most of the teenage girls. So in the ads, I hope you have seen already in the ads, the Janvi Kapoor is giving the ad for the cervical cancer vaccination. So it also comes under, like a government is asking her to give the advertisement to health promote for the whole community, not only for the Janvi Kapoor, but it is for whole community of the girls, right? So it comes under, see, vaccination. If you take vaccination for yourself, it comes under the specific protection. If government asks anything to do, okay, for the better community protection, that comes under the health promotion. Okay, so I'm going to write, okay, first safe water supply, so it's going to benefit whole community, right? And good sanitation facility, and control of air pollution, and midday meal program. And fifth one is health education. So all these 5 examples comes under the health promotion. See, government is asking something to do. I am putting here government. If government asks, or government posters are given in the exam, that comes under the health promotion. That was under the primary. Okay, you need to mark it as health promotion. If government asks you to do anything, it comes under the primary and it comes under the health promotion. Okay, next, here in the specific protection, use of helmet. So it is benefiting us, right? If we are going to meet any accident, it is like it is safe for us to use the helmet, right, while during the driving. That's why this is going to help for individual, not for the whole community. If you wear helmet, you will be protected, not your friend, right? This is the simple example I'm going to give you. And the use of seat belts and vaccination. See here, if government asks you to wear the helmet, okay, it comes under health promotion. If you use the helmet by yourself while the driving, it comes under specific protection. I am telling you again, if government asks or government posters are given or government advertisements are given, even for vaccination also, you need to mark it as health promotion, not specific protection. I am stressing this point again. If your question comes from this area, you need to answer right. Okay. Anything asked by the government to do, anything awareness program given by the government to do, it is benefiting whole community. So you need to mark the answer as primary health promotion. Okay. Here the vaccination and iron, folic acid tablets in pregnancy. So these are the examples coming under the primary level of prevention. Okay. So here one small question is there. So I hope I have told you already. So wear seat belt in the car is which level of prevention? This is the first question. In the first question, you have 4 options. You need to choose one of them. Okay. Try to answer this question as soon. I'm giving you 20 seconds time. Wear seat belt in the car is which level of prevention? Yes, this is, I hope everyone answered this correctly. It comes under primary level of prevention. So why this comes under the primary level of prevention? We are wearing the seat belt because we are having a risk factor of accident already. So here the risk factor is already present. That's why it comes under the primary level of prevention. Okay. And you are going to answer the second question as well. It is also very easy. Try to answer this second question. Wear seatbelt in the car is which level of prevention? Primordial, primary, specific, or tertiary? Yes, yes. I hope you all guys answered correctly. It comes under the specific level of prevention. See, if you mark the primary, this is wrong. You need to mark the specific right answer, probable, the most accurate answer you need to mark. See, primary is also right, but here there is an option of specific. Specific is there, so you need to mark the answer as specific. If you wear the seat belt, you are going to benefit only for yourself, right? Your friend is not going to benefit by this. This is not an health promotion. Okay, this is not given by the government. I just given in the question as wear seat belt in the car is which level of prevention? It comes under primary in the first question, but in second question there was a specific as an option. You need to mark that, because it comes only under the specific level of prevention. This is benefiting only for individual, not for the whole community. That's why I mark it as specific. And in secondary level of prevention, I already tell you all the screening test comes under the secondary level of prevention. All the screening test, let's say ultrasound and a pap smear, let's say, and screening test for a color blindness, all this comes under anything screening, anything annual health checkups, all this comes under the any test or any checkups comes under the secondary level of prevention. In tertiary level of prevention, what we are going to do is, already we have a disease. Okay, we are going to prevent the complications. We are going to prevent the further complications of the disease. So that's the reason I'm going to write here as disability limitation. So we are going to limit the disability, right? And if he was an chronic smoker or chronic alcoholic, we are going to send him to the rehab centers to prevent the further complications of the disease, right? So rehabilitation also comes under the tertiary level of prevention. See, here I am going to make a small box, so you are going to answer it easily if any question comes from this box. Okay, so let's mark it. See, in the primordial level of prevention, there was a risk factor present or absent. In the primordial, right? No risk factor present. Disease is present in the primordial? No disease. Complications? See, we don't have disease, we don't have risk factor. How we can expect the complication? So no complications. We have disability? No disability, because we don't have disease, we don't have complications. So no disability is present. But when it comes to the primary, let's say in the primary, answer me, the risk factor is present or absent? Yes, risk factor is present. Here disease is present or absent in the primary. Here only risk factor is present, disease is absent. So no disease, no complications. If no complications, no disability. But in secondary screening test comes. See, here the risk factor is present or absent? Risk factor is absolutely present. Disease may be present or absent. Complications, if the disease is present, there may be complications, but if the disease is absent, no complications and no disability. See, in tertiary, absolutely risk factor is present and disease is for sure it is present, and complications, here main aim of us is to, in tertiary, is to prevent the disease complications. See, here complications is absolutely present, but in disability sometimes present or sometimes absent. So by just looking at this table, you can easily understand the risk factors is present or absent or disease and complications and disability in the each level of prevention. And in next we are going to discuss the small examples. I hope you guys understand the whole concept up to now, and by just seeing these examples you are going to answer which level of prevention is this. Okay, you guys going to answer with me. So which level of prevention is this? Screening test for the color blindness. I said you already, screening comes under what level of prevention? Primordial or primary or secondary or tertiary? It's not primordial, it's not primary, it is screening. So secondary level of prevention. Annual health checkup, I already told you whatever the tests we are going to do and whatever the health checkups, it comes under secondary. Chemoprophylaxis. See, what does this chemoprophylaxis means? So we are just giving the patient any drug to prevent the disease. Any microbial drug we are giving for the patient to prevent the disease. Okay, to prevent the disease, he is already having risk factor, guys. He is already having risk factor. So we are going to prevent the disease. So it comes under primary. In primary, there are two types, I already told you. Health promotion and specific promotion. It comes under what? We are going to give the drug only for a single person, not for the whole community, because he is only having that risk factor. So it comes under specific. Okay, this is not an health promotion by the government, so we are just marking it as specific. Okay, encouraging kids not to start smoking, so he don't have any risk factor. Kids, let's say he's 8 years old, he's 7 years old, he don't have any risk factor. We are just asking them not to start smoking. When they grow old, they are going to start smoking. That's why we are asking them not to start smoking in the age of kids. Okay, here this comes under primordial level. Okay, and rabies post exposure prophylaxis. So if already patient is exposed to rabies, so what we are going to do? There was a risk factor is present, but no disease is present. See, rabies is a risk factor for him, but no disease is present. So it comes under primary. In primary, it is health promotion or specific. This is only for one person. This is not any advertisement by the government. Okay, it is specific. So next example is change of water in the cooler, air cooler every week. So what this comes under? We are changing the water, because this comes under the primordial level. And use of cervical collar. when a patient, any of us met with the road traffic accidents, RTA, we don't mobilize the neck because it gonna damage further. We are going to prevent the damage by applying the cervical collar for them. So it comes under what level of prevention? Already the disease is present. See, they met with the accident already. So what we are going to prevent is the further complications. So we are going to prevent the complications by using the cervical collar. Okay, it comes under tertiary. Emergency contraceptive. Emergency contraceptive means, let's say they already have risk factor of pregnancy. Okay, why they are using the emergency contraceptive? They already had a risk factor of an pregnancy. To avoid that pregnancy, they are taking an emergency contraceptive. Okay, so to avoid pregnancy, so risk factor is already present, but disease is not happened yet. So we are preventing the disease. We are preventing the disease by controlling that risk factor. It comes under primary. Okay, primary, what it comes under? We don't give the emergency contraceptive for the whole community. We are just giving for an individual. So it comes under specific level of prevention. And here these all three never primordial. In the question, if you see quit smoking, weight reduction, lifestyle modification, if you see these three options, I'm just going to explain it why these are not primordial. See, if you ask the patient to quit smoking, he is already been smoking since from long time. Okay, since from long time, if he is smoking, he is already having a risk factor. Okay, weight reduction means they are they are in 100 kgs, let's say they are in 105 kgs, they are in 120 kgs, they are in obesity already. So they are under the risk factors. They are already having the risk factors for cardiovascular accident or cardiovascular strokes. So for lifestyle modifications, for which kind of people will suggest the lifestyle modifications? Let's say he is not following the good habits, he is not having any good habits, he is not following the regular food timings, and he is not having the good pattern of sleep, and he is not following the good healthy habits. So for them, we are just suggesting them to follow the lifestyle modifications. These all three examples never be primordial because there was already risk factor present for them. They are in worst conditions already. They are exposing their body to worst conditions. They are already smoking. They are under the heavy weight. They are in the bad habits. So that's why risk factor is already present. So it never be primordial. It can be primary or secondary or tertiary. Okay, it depends on the question. If examiner asks, let's say if a 30 years old man comes to the clinic, okay, he don't have any disease, but he just came, and he is a chronic smoker since from 18 years, and he is 13 years old. He is 30 years old now. So you ask the patient to quit smoking to avoid the risk factor, to avoid the disease. Okay, to avoid the disease, he is already having risk factor, because he is smoking since from long time. He is having a risk factor of lung cancer. So that's why you ask him to quit the smoking. So it comes under the primary level of prevention. Let's say a 40 years old man already had heart attack. Let's say heart attack. Now the doctor asks him to stop smoking. Okay, why he asks him to stop smoking? Further, it complicates the disease. Let's say it comes under tertiary levels of prevention. So this is how you are going to differentiate in the exam. Okay, if anything comes like a screening, it comes under the secondary level of prevention. So I have given the images here. You are going to mark the answer, what level of prevention it comes under. See here, mammogram we are doing. The mammogram test is for screening. Screening test always comes under which level of prevention? Secondary. secondary screening. And this is second image. In second image, one guy is spraying something. What is that? This is the spray to kill the mosquitoes in the trees, right, to prevent malaria. So it comes under what level of prevention? Primary. Here risk factor is already present. Risk factor means malaria or any other diseases is already present, that's why this guy is spraying the mosquito spray to kill the mosquitoes. It comes under what level of prevention? Primary. In primary level of prevention, what it comes under? It comes under the individual or the community? It comes under the individual or health promotion? What? See, he is spraying that so that there will be less mosquitoes. It's going to help for whole community, not only for that guy, okay, not only for you and not only for me. If anyone sprays that mosquito sprays, let's say if a government person is going, some vehicles are going on the road, they're going to spray the mosquito sprays on the streets, okay, the white smoke will be coming, right? That smoke will kill the mosquitoes. That's why the less mosquitoes are there, so everyone get benefit. Not only in my house, like everyone's house, the mosquitoes will be less, so less diseases, so less risk factor is present. So that's why it comes under health promotion. And next is protected together. See, something ad related to vaccine. It comes under what level of prevention? Vaccination. Vaccination comes under what level of prevention? This is an advertisement given by the government advertisement to prevent diseases by vaccinating. It comes under what level of prevention? It comes under, yeah, you are right, primary. It is under health promotion or specific level of prevention? Yes, it is a ad given by the government for the awareness, for the health education. So it comes under health promotion. And next one, here the ad is there, your health is in your clean hands. Let's say this is a poster given by government. In times of COVID, we are washing our hands every time, we are using the sanitizers every time, and the government asks us to do that. So it comes under what level of prevention? Primary health promotion, okay. It comes under primary health promotion. And next image, this is very important image, and what the doctor is doing here, this is pap smear. See, what is this? This is pap smear. Pap smear is a screening test for the cervical cancer, so it comes under secondary. I am writing it here again. This comes under secondary. This is screening test. If the image question comes, you need to mark that as secondary. I am stressing each and every point because you need to answer each and every question correctly. One question for sure going to be coming on the upcoming exams. You need to answer that rightly, okay. And here the black hands is there. This is nothing but gangrene. In gangrene, the disease is already there. What we are going to do is we are going to prevent the further complication of the disease. So this comes under tertiary level of prevention, okay. And next image is the lady is doing an ultrasound for thyroid, okay. Ultrasound is a screening test for the thyroid that she is doing. So it comes under what level of prevention? Secondary. So it is screening test. And next, last image is here the persons are standing by some distance. So this is social distancing. Social distancing is followed by everyone during the COVID times. It is coming under what level of prevention? So government asked us to stay some particular 6 feet distance from each person. So it comes under, it was given by the government. So it comes under primary health promotion. So this is all the topic what I have discussed. This is good enough to answer in the exams if the question comes from this topic. And I am going to revise a very tough area what you didn't understand. Just if you just understand these 4 points, you are going to answer all the questions. See, in the primordial, what is there? No risk factor, no disease. This comes under pre-pathogenic phase. In the primary, risk factor is there and disease is absent. So this is pre-pathogenic phase. In secondary, all the screening tests like a pap smear or any ultrasound or any health checkups or annual health checkups, it all comes under screening test. And next is tertiary. Tertiary, we already had disease and we are preventing the complications. Okay, that's why we are already having disease but we are preventing the complications. That comes under the tertiary level of prevention. So how we are going to achieve it? Primordial is by health education. We educate that if we educate the kids not to start smoking, that comes under the primordial. If we ask the lady to change the water in the cooler every day, it comes under the primordial. So here no risk factor is present, but in primary risk factor is present. So by risk factor we are avoiding the disease. It is primary. Under primary there was an health promotion and specific protection. In health promotion, whatever the things we are followed when the government orders us to follow or any advertisements given in the TVs or in newspapers, it all comes under health promotion. And the specific protection is whatever the things we are doing for only for ourselves to protect ourselves by wearing the helmet, by using the seat belt, by vaccination, by giving iron folic acid to that pregnant lady, it all comes under the specific level of prevention. Okay. And in secondary, screening test, all the screening test comes under the secondary level of prevention. In tertiary, there was a disease, we are preventing the complications, we are disability limitation, we are using the disability limitations and we are using the rehab centers for the rehabilitation for the chronic smokers or chronic alcoholics or chronic drug addicts. Okay. And these are the features, and this is the small box. You need to just have a look and you are going to understand. And these are the examples of the prevention. And if any example comes in the exam directly, you need to mark it as rightly. Okay. And these are the images I already told you. Just have a look once. And this is all about this topic, and I hope you all guys you guys all like the topic whatever I have said you. And this is the easy way and easy way to remember the stuff. This is how I remembered it, and the way I remembered it I'm explaining you guys the same way. So I hope you also make your own ways and remember all the stuff easily. And all the best for your coming exams, and best of luck for everyone. Yeah, thank you very much.